have scoliosis and you have pain, what are your options to get some relief? In my 26 years of practice, when I consult with scoliosis patients, I kind of see two types of patients. I see kids with scoliosis who normally have no symptoms or pain as a result of scoliosis. And then I see adults that come in my office complaining about severe pain. And so why do we have people with the exact same condition that feel very different? And so one question I always get asked is, well, isn't scoliosis always painful? And adults think it is, and kids, like, obviously they have no effect of it. And even though every case of scoliosis is unique, we know scoliosis is not commonly painful in children and adolescents. Kids don't feel pain as a result of scoliosis. In fact, if they feel pain, it's normally very mild, and it may not be any different from kids that don't have scoliosis. So therefore, we don't expect children to experience pain. In fact, if they have pain, we normally consider that a red flag, and we're normally looking for another cause. So if you have a child who has scoliosis and they have no pain as a result of it, don't be surprised that that's not unusual. That's very, very common. And that doesn't mean that curve isn't worsening. Normally with children, the only thing that you're seeing is postural signs as the first thing that's actually causing the problem. In adults, the scoliosis, unfortunately, can become painful. And the reason why it can become painful is because of how the curve progresses in an adult is very different than how a curve progresses in a child. The type of pain that adults tend to feel is most likely back pain. It's normally right at the size of curve, but it can also lead to other types of issues. It can lead to radicular pain that's happening from compressed nerves in the area of the spinal curvature, and this compression can lead to numbness or radiating pain down into your legs or arms, across your rib cage, even up into your face and head. It can lead to muscle pain and tightness and soreness because of the unbalance. It can lead to fatigue in the body. It can also lead to asymmetrical, normally lower extremity pain, like hip pain, knee pain, ankle pain, foot pain. Like an unaligned car, one tire will wear out because it's receiving more pressure and more weight. The same thing is true with your body. So you can have more pain on one leg or one side of your body, like knee and those kinds of things. That could be a sign that the curve is actually progressing. In fact, sometimes in adults, that's the very first symptom, is they start having like a unilateral hip or knee or ankle problem, and they've had no injury. It's just happening because of an alignment is leading to that. They can also get some headaches and some neck pain. Headaches can be a result of two different things. It can be because of nerve compression as well, but because we know scoliosis can affect the flow of cerebrospinal fluid and blood flow going up into the head because of the shape of a lot of times these curves go all the way up into the cervical spine, it can lead to headaches in those areas. So why is scoliosis more painful in an adult and not the way it affects children? Well, since pain tends to be the number one thing that brings out the diagnosis of scoliosis, and it also is the number one thing that brings out the treatment of scoliosis in an adult patient. And the reason why pain is not associated with children and adults is because children or adolescents, their curve is progressing because they're growing. And this growing is a lengthening process that counteracts the force of compression of gravity. So therefore, since there's no compression, there's no pain. They're progressing because they're growing. However, once a person stops growing, the spine and the muscles are exposed to constant gravitational forces, and these are trying to withstand those forces, but you can't withstand the forces of gravity over time, and gravity continues to compress the spine over time, and this compression will eventually lead to pain. Now, the fact that kids don't have pain can make it sometimes difficult to diagnose because the only findings you're going to have are going to be postural, like I mentioned. So if you see a postural misalignment and you see your child's posture worsening and you know they have scoliosis, but they don't have any pain as a result of it, don't take that postural worsening lightly. That's more likely leading to progression, and it can more likely occur while they're growing. So the fact of not feeling any pain, again, don't think that that's a reason why the curve isn't worsening. It still could be worsening. When we look at adults, what are the best options to try to improve their pain? Well, first of all, is being proactive. We know that the amount of pain a patient feels, especially as an adult, is definitely related to some key variables. Number one is the age. The older they become, the more likely they are to have pain. And the younger they are, the less likely they have a pain. So if you treat curves smaller while they're younger and never let them become more severe. As you get older, it makes sense. You're much less likely to have pain. The location of the curvature. Lumbar curves typically cause more pain than thoracic curves or cervical curves because they're bearing the weight of the whole body. So the lower the curve is, the more likely it is to cause pain. And then, of course, how much it progresses as an adult, the severity. The more severe a curve is, the more likely it is to cause pain than a smaller curve. Now, interesting, it's severity, but it's really progression as an adult. So let's say we have a child with a 100-degree curve. Okay, the biggest curve I've ever seen with a child has been 155 degrees. That child had no pain, right? So we honestly think that if somebody goes into adult life, say with a 100-degree curve, and they hold their curve at 100 degrees their whole life, they may not feel any pain as a result of it. But if we have an adult or a child that goes to 20 degrees, they stop progressing at 20 degrees, and now they progress as an adult to 30 or 40 degrees, they're going to have pain because they progressed and compressed as an adult, and that causes pain. So it's not necessarily the size of curve, it's really how severe the curve progresses as an adult is what we believe is the biggest indicator for how much pain that you're going to feel. The number one treatment options tend to be, unfortunately, prescription pain medications. And prescription pain medications, yes, they may help you a little bit with the pain that you're feeling, but they're not correcting the structure of the spine, so they're only providing short-term pain relief. They're not really addressing the cause. They're more like treating the symptom as a result of the scoliosis. Sustainable pain relief can only be achieved through proactive treatment, meaning actually reducing the size of the scoliosis. I always say there's a very big difference in treating the symptoms of a patient's scoliosis versus treating a patient's scoliosis, meaning reducing a curve is very different than making somebody feel a little better who has scoliosis, because by making them feel a little bit better, you're definitely helping them. But if you're not addressing the underlying cause and the progressive nature of scoliosis over time, you're just kind of kicking the can down the road and leading to more severe issues as they age. You really want to address the cause. So what does a proactive treatment look like? Proactive treatment are really customized treatment plans for each and every scoliosis patient. And it's normally integrating not only their size of curve, but it's integrating their age, their activity levels, what they're looking at doing, and also how much reduction that we're looking or progression have we seen, or how much reduction we're trying to achieve. Integrating different treatment options and different treatment disciplines to provide the best possible result. Normally, just doing one treatment won't give you the best option. Like a lot of adult patients will start doing some exercises and they'll feel a little bit better, but they're not getting a reduction in the curve. They're just going to feel a little bit better. Maybe they will get massages and they feel a little bit better from massages, but they're not reducing the structural level, so the curve is still progressing. And eventually, whatever they're doing, that one thing they're doing is normally not enough to overcome the structural component of the scoliosis. So truly addressing the problem is addressing the structural level of the scoliosis and reducing the size of curve. Because the bottom line, if you're not reducing the size of curve, you're not really correcting what's causing the problem, and you're just managing their symptoms. So what treatments can be associated with trying to help reduce the size of curve? Well, they're sometimes similar to the way patients try to get pain relief. A lot of times patients will go see chiropractors. They'll get some in-office therapy. They'll get some home exercises. They may even start wearing a brace. But what ends up happening most of the time is scoliosis patients are treated like they hurt their back, meaning they have some back pain. They go see a physical therapist. They go to a chiropractor, and they're normally treated with something that I call low-dose, long-duration treatment. This low-dose, long-duration treatment is typical rehab. You do a little bit of care over a very long time, and it tends to help you in the moment you're getting your treatment. But unfortunately, your curve is still progressing. We still see curve progression over time, and there's very little data that says that does anything to stop progression. So the first thing that we do different is we invert that model. Instead of doing low dose, long duration, we do high dose, short duration. This high dose, short duration treatment incorporates all those things I just mentioned: chiropractic care, in-office therapy, scoliosis-specific exercises, prescribed home exercises, and corrective bracing. But we do it in a very condensed and coordinated model that provides the very best results for that patient, meaning a rapid reduction, not slow rehab like you hurt your back. This concept of slow rehab doesn't work with scoliosis, because scoliosis is not an injury that you acquired over one day. It's been slowly progressing and developing over your entire life, especially in the adult stage. So doing this rapid reduction followed by stabilization afterwards is what produces the best results. And we find that's the biggest missing key when it comes to the treatment of scoliosis. Most patients are being treated like they hurt themselves, not like they have scoliosis. And this big disconnection between treating these people differently is the biggest hole I see in when patients are seeking their own type of, or trying to put together their own scoliosis program. So Scoliosis Reduction Center, not only do we provide a proactive treatment model, but we provide this unique scoliosis treatment that's treating more than just the symptoms or the conditions associated with the scoliosis. We're actually trying to address the scoliosis, which is causing the symptoms and the conditions that the patient's experiencing. If we can reduce the curve and we can increase the strength of the body and proactively address the size of the curve and the structure of the spine, we are addressing what's causing the pain and dysfunction. And this is really what's the underlying cause of all their problems. If we can do that, then we're truly getting people better functionally, physically, and also symptomatically. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.